is our first series. Our last one series, we talk about mental health. And today, thanks to Dr. Abel, he's going to share with us today a lot of cases, very interesting cases. And some is actually, and basically he translated and transcribed everything from Spanish into English for us. Let's give him a big applause. It's a lot of hard work. I really appreciate and salute him for that. Thank you, Dr. Abel. And he actually prepared all the video with his team. I really, really appreciate Dr. Abel for putting all this effort for us. So today we are going to focus on cardiovascular diseases, which Dr. Abel will share with us all the cases, including stroke, hypertension. And I think we've lately a lot of things that about heart issues, which is irregular heart rhythm and all these things. Dr. Abel will talk in more detail with us about that. Okay, so these are our key speakers today. So before that, let me invite our guest speakers for today, which is none other than Dr. Lennie Soo. So Dr. Lennie Soo is actually our Persatuan I-Inspire founder. She actually founded this NGO, which is NGO stand for non-profit organization in 2017, which is about 7 years ago. So she's actually a neuro-counseling psychologist, a clinical hypnotherapist, an NLP trainer, and also alternative medicine therapies as well. Her clinic is actually in Wisma Life Care. So for those that who want to join us for monthly group Agni Hotra, please visit the rooftop of the clinic, which is we are going to practice on this Sunday together. So without further ado, let me invite Dr. Lennie to share with us a few words about today's topic, Homa Therapy in cardiovascular diseases. Dr. Lennie, I pass the floor to you.
Thank you very much. Namaste, Hooi Lin. And Hooi Lin is the most hardworking person that I know. And thanks to her, we have all this. I'd like to thank all the guests who have joined us today. I can see Dr. Lorraine. Thank you so much, Dr. Lorraine, for all your effort. Dr. Abel, always a pleasure, and I'm so looking forward to your presentation. Today, I also wanted cardiac arrest is a growing problem all over the world. And it is the most common reason why humans die. So today's, at the end of this webinar, maybe I can share a method or a crisis management tool that you can download and you can help yourself and help us also to save more lives. But for now, I will hand over the floor to Dr. Abel. Dr. Abel, thank you.
Om Shri, everyone. Om Shri.
Om
What a
Shri.
joy. Always a great joy to be in this group and have the opportunity to share some of the experiences we got with Homa Therapy. And in this case, we're gonna be dealing with cardiovascular circulation problems. As Dr. Lennie says, these heart attacks, stroke, and so on are very common nowadays. And right and left, up and down, you hear cases of many people who have been going through these situations. Anyway, the idea is to bring good news to everybody. And once again, we tell the people, please do not believe anything we say or we show. This is probably a makeup, maybe something that a conspiracy, whatever you want to call it. I know nowadays you can believe anything. However, I'll invite you to be open-minded, because before a new situation, you always have three possibilities, maybe more, but the most common ones is you can believe everything you hear. The second one, you reject everything you hear. Either one of those two is just a sign of fanatism. There is enough fanatic people around. There is a third group or maybe more groups, but the third group that says that I don't believe anything. I don't understand anything you're talking about, but I do want to know. I do want to have experience. I want to test it. And you might want to take the tool and practice and observe and get your own experience. Once you do that, you'll know. And like you know, they say around there, the truth will free you up. Truth can liberate us. So don't believe, put it to the
Yes,
test. Put it to the test. Now,
definitely.
today's videos are going to be very short because this translation and then dubbing is a complicated job. So we try to cut the extra and just go straight to the point. And by we have a lot of help. Some people like Harold Hernandez, he was very useful, and his wife, Patricia, and so on. They have been helping with the translation and the transcription also. So let's see, we show you something first. We'll show something about Professor Pacheco. Professor Pacheco, that was in Lima. He came because he has some problems health-wise, and he lived in a community which was difficult. There is a lot of violence and so on. Anyway, let me just show you, and you have hear from himself his experience. This is sharing the experience with everybody. You see here, Professor Victor Pacheco, healing hypertension with Homa Therapy. Hypertension, you know, is one of the most common problems worldwide, high blood pressure. And usually people are told that they have to take some medicine, and this medicine have to take it for life. They have to continuously be taking this. Is it possible to get off of this hypertension without medicines? Most people will say no. Most medical doctors will say no. And this is okay. However, don't be surprised if you try this, that gradually you will be improved, you will normalize, and you might not require that. That's for you to find out. Let's hear.
Dr. Abel, you have to share your screen first.
By the way, it's almost unavoidable when we talk about Homa Therapy and testimonies that you will hear something else besides just high blood pressure or something like this. In this case, it's talking that for him was amazing how, in spite of many people catching flus and so on, people with Homa Therapy, they were not catching the flu, or they were very, very little affected with that flu. But let's continue seeing. This is where he noticed first, and then
Dr. Abel, you have to share your screen.
you hear anemias, allergies, and so on. People also got here with that.
Dr. Abel, can you please share your screen? Because we can't see
I'm
the
sorry,
video.
I'm sorry. Oh, I'm sorry. I thought I was sharing the screen. Wonderful, wonderful, Mrs. Rui. Thank you for letting me know. Wow. Was very okay. Yes. I thought it was coming out. 1 second. 1 second. Now you will hear. Now you will see. Anyway, you got an introduction, oral introduction now, and it's okay. Can you see this?
Yes, now we are.
Professor Victor Pacheco, healing hypertension with Homa Therapy. Okay, let's listen to the professor.
One really amazing thing I have witnessed since I started with Homa Therapy is that during this rainy season, very few of the people who regularly practice Homa Therapy got the flu, even though this is very common in this type of rainy weather for people to catch the flu. This is one of the experiences I have had. Also, people with allergies or anemia take the ash and they get cured. And I can mention many more cases. I recommend to all of you to continue doing this, and that those who don't do it yet start as soon as possible, because this therapy will bring a lot of good things into your lives.
Professor, in the past, did you suffer from high blood pressure?
Yes, I most certainly did.
Can you tell us how it was for you before you started with Homa Therapy?
My blood pressure was between 160 and 170, and now I no longer have high blood pressure, even though I don't take any medicine for it.
He's referring to the high blood, that contraction. You know that it's usually high and low, but that's that 160, 170.
A month before I started with Homa Therapy, I had gone to the insurance doctor, and he had prescribed me some sublingual pills. Those helped me a bit in the morning, but in the afternoon, my blood pressure would rise again. And then I started with the Homa fires. My blood pressure began to drop. A month later, I went back to the insurance doctor, and he told me, I am glad the pills are working for you, but the truth is, I was no longer taking them. The doctor had told me that I was going to be hypertensive for the rest of my life, that I had to go do some activity on Saturdays and walk on the beach with other people who were also affected by hypertension. But fortunately, I didn't need to do that. With just the Homa Therapy and the fires, I have achieved that healing.
Can you please tell us your full name for the video?
I am Uriel Pacheco. I live.
Okay. So that was Professor Uriel Pacheco, high blood pressure. And here, as you hear, he have other people who have allergies and anemia, and even though in the surroundings, a lot of people were catching the flu, the people who were doing the Agnihotra and these fires, they weren't. So this is one simple, brief testimony. We have more to share. If you have any question in relation to this one, this video we just show, we can go like this because they're very short. So I'll show this one, we can go to the next one, and so on.
I just want to notify the people in this group that people who are when we talk about high blood pressure, we are talking about the systolic and the diastolic. So the systolic should be normal one should be less than 120, and the dystolic should be less than 80. Now, Professor just now said that his was 160, and above, and that is a very, very high blood pressure that can cause a lot of different issues. So please check your blood pressure. Remember, 120 over 80 is normal. Anything outside that range is not normal. Dr. Abel, I return it to you.
Yes. Now there is some variation to these figures depending on the age. Okay. Depending on the age. However, the standard measure is like Dr. Lennie Soo's, 120 over 80. This is, but don't be surprised. Some athletes, they can have a little lower than that, and they are in perfect shape. In fact, I do remember when I was doing my medical studies, and professor in cardiology would say, truly speaking, there is very few cases of low blood pressure. People talk about low pressure, but there is purification. Most people is high blood pressure or hypertension. This is what you see most often. The stress and so on, you increase that. Now, there are many factors. It's good to talk about that can produce this high blood pressure. One of them will be the stress, the tension that is going around, the worrying. Also, food, kinds of food that you eat that are saturated fats and so on. Also, the lack of exercise. You don't exercise, the heart doesn't develop as well, the arteries, they lose the flexibility and so on. So there are many possible causes. And there is, who knows, maybe something that people put into their bodies that can create clots. And you might know what I'm talking about. There is some ideas about that. And we even talking about this, people who have been doing fires and taking the agnihotrage have helped themselves even from these problems, which were caused from exogenous source, I mean, external sources. So please take care of yourself when it comes to what you eat, what you think, what you hear, what you think, emotion, and what your emotions that you hold. Everything. There is one other connection. Remember the heart, and I like this symbol that you have. I-Inspire with the hearts. You have those hearts, beautiful there. Is the loving center, and it is traditionally in bioenergetic vibrational medicines relating the heart with love, with ability to love. When people have some problems and to love, either to love or to be loved, they have some blockages. And you know, you hear these blockages in the coronary arteries and so on. This is a common thing. So you can, when you do this Homa fire, something beautiful happens. And it is your ability, your perspective, your around life changes, and you become loving. And there is a connection between body and mind without any doubt. So some people who have resentment can have problems with the liver, anger, and so on. People who have problems with open up to the feeling of love also have problems with the heart. So open up, and this is one starting point to start releasing problems that bring you into heart or circulatory problems. Anyway, and that was a good observation, Dr. Lennie Soo, referring to the systolic and diastolic prayer. Yeah, the contraction and the relaxation of the muscle. Usually one is the one that contracts is one that punches with the heart, increase the blood pressure, and when the blood vessels are fragile, they can break and they can create a stroke. You know, the disease is not just one little thing, it's one cause that can generate into many other factors. So high blood pressure can do it, give you a heart attack, it can give you a stroke in the brain, it can give you some thrombosis, it can give you some embolism, it can create many other problems. Okay, it's not just high blood pressure. The consequence of high blood pressure are the problems. But usually the conventional treatment is just so-called bring the blood pressure down. But what is pushing the blood pressure up is not look into it that often. With Homa therapy, we can do. And when we talk about Homa therapy, we don't talk only of doing these Homa fires, especially Agnihotra, but we're also talking about the usage of the Agnihotra ash, the taking orally of the Agnihotra ash in this case, several times a day, that is no overdose. Okay, so all these people you will be hearing, they have been practicing the Agnihotra at sunrise and sunset, in the morning, in the evening, and also taking the Agnihotra ash. Let's continue with another video, unless there is any question about what we said. Okay.
Dr.
No
Abel, like for example, with the ash, the Agnihotra ash, you were mentioning that we can take the ash many times a day. And I know that a lot of people with cardiac problem, even for me, I will recommend that they take it like tea, the whole day, just drink this Agni ash whenever they feel thirsty. In your experience, how much is too much? Is there such thing as too much? And what is the dosage? Is it 1 tablespoon or 1 teaspoon? Because some people are very specific, so we need to give them that dosage,
Yes, this is okay. Good question. And remember, everybody's constitution, everybody's body qualities are different. And some people respond right away with just a little bit. However, as I said, there is no overdose of the Agnihotra. We have seen people who can take, they do a pyramid and the whole fire is there, and everything that was there in one, they take it all. They feel it, the body requires, and it helps them a great deal. Other people, they can spread that into 20 times or 30 people. It just depends. A little bit, a little pinch with water or simple like that. For some people, it's enough. However, I must say that lately there have been a problem in the area where we were in Peru. I don't know if you heard of dengue. Dengue is like a
we have dengue in Malaysia also. Dengue fever, yeah.
Dengue fever is horrible, and in this, and it happened to be with the rain and all this, the mishandling of the waters and so on, that they can come up and produce a lot of it, and then there is an infection, right? And people, they got hemorrhagic dengue. Hemorrhagic, like there is, it get bleeding and so on, and people die. A lot of people were dying, and it still is a problem, but it has come down now. So, and it's almost unavoidable not to catch it, because you cannot go anywhere. Probably you try to not go anywhere where people have these kind of problems, but the mosquitoes go everywhere. So a mosquito bites you, and this mosquito is infected with this then you catch it. So my wife and I, we got some kind of cold. We don't know if it was dengue or not, because now everybody gets, colds. There always have been cold, and I believe colds will be always around. It's part of nature to have these viruses, and your grandparents knew about colds. Your grandparents knew it always have been around, and we think it's foolish idea of the vaccine for a cold or for a flu. This is just nonsense, because it mutates so much that it doesn't make sense. You cannot make a vaccine for each virus just like that. That doesn't make. Anyway, we did cut the cold, and it was horrible. You were coughing and all this kind of thing, headache, and just think, and we noticed as soon as I started taking Agnihotra ash in more quantity, the relief was immediately. As soon as I started taking more quantity, I usually take just a little bit. I usually just, and when we do the fire with people, I take a little bit and I give it, we show the people. And normally in the house, we have in the water bottles, we have big 20 liters of bottles, and we take water from there and also. But when I remember one time I was in Colombia, and there was a flu, and they call it the bone breaker flu, bone breaker food, because you think you were broken up completely. It was horrible. In fact, I thought I was gonna die at that time. That was long time ago. Before at that time, I was very new to Homa Therapy. I just started, and I was sharing the fires, but I was not taking the ash myself. I was just talking about it, and people were in relief and so on. Sometimes people do that, you do certain things, but no, you're not leaving it completely. That was many, many years ago. So by one of these strange cases, Master Shiva-san, he the one who was teaching the fire all over the world, and he was the one who trained us to do this kind of service with the Homa Therapy. Well, anyway, I was very sick with this flu. This is called bone breaker flu in Colombia, in the city of Santa Marta. It's a beautiful area, but I was there and I was laying in bed. I was staying in it with the family, and I will not eat or drink anything. I didn't want to do everything was pain. The eyelashes were in pain. The tip of the nose was in pain. Everything was in pain. So I didn't even want to drink water, because drinking water means you have to get up and go to the bathroom and pee. And I didn't want to do that. So I just wanted to be there, no moving at all. One day, no eating, no drinking, nothing, just no moving. Second day, the same thing. Third day, I was the same thing. The third day, we got a phone call, and it was Master Shiva-san. And I answered the phone. He was in India, we're in South America, Colombia. And he asked, "Oh, how are you?" And I remember I said, "Oh, I'm very happy because I'm talking to you. This is, normally that doesn't happen. It just happened to call, and I'm just very happy." And I said, "I'm very happy, but I think I'm going to die." And he said, "What?" "Yeah, I have a feeling." And then he asked me, "Did you take the agnihotrash?" And I said, "No, I haven't taken it." And then he said, "What are you waiting for?" So I got a guy in the trash. That was in the morning. At noon, I was up every walking and having lunch and all this. And the family, I was staying here. "What happened to you?" "We were ready to call an ambulance and get you out of here because we were certain you were going to die. And we wanted you to die somewhere else, but not in our house. Go die somewhere else." So that was like this, very fast. So it just happened to be that I was very feeling bad now with this, I told you, this cold, flu, light, dengue, whatever it was. And I said, "Oh my gosh, I had to take more ash. I need more ash." So I got the spoon, and and then I get 1 hour later another spoon, and then I felt, my gosh, I feel much better. Just just like this. So taking several times. So every hour I was taking more ash, and by divine, now we're okay. No problem. I could, can you believe I lost my voice? I couldn't even talk when that was happening. That was amazing. I said, wow, this is nonsense. Anyway, this is a personal story. This happened, whether you believe or not, it doesn't matter, because it happened just recently. And it happened, you can go and check in the news. Peru dengue. Lately, it has been big struggle, but not here, no with us. Okay, so let me keep sharing.
It is very interesting, Dr. Abel, that you talk about how Homa therapy can also help with dengue, because Homa therapy cleans the entire environment, and keep the mosquitoes away. And
Yes.
At the same time, when you take the ash of the Agnihotra ash, one thing that I always feel, I don't know about everybody else, but I don't know about you also, Dr. Abel, but I always feel my body getting very hot. And with dengue, it's always about the lower red blood cells. And I think I believe that, when you take the ash and it flushes through your entire nervous system, it allows the body to heal in a way that it produces more red blood cells. You will definitely feel the effect of the ash when you take dengue, when you have dengue. Thank you, Dr. Abel. I'll pass it back to you.
Thank you. Remember this Professor Alberto, he did mention people with anemia. Remember, he said anemia, allergies, and other flu, and so on. So yes, you will find when people start giving their experience and testimony that they have many things are helped, many things. Anyway, it's time to share another short video. Let me share another one. Let's see which one comes into the picture, because there are several. And let me see. Oh, I cannot minimize your recording. Okay, but I had to see my. 1 second. I was recording, but I have stopped recording. I hope you're recording over there so we can share later.
Yeah, we have FB Live, so anytime we can view back later. No worries.
Okay, let's, one of the problems that you see with the circulation are varicose veins, right? So let me show you one of the varicose veins. This is a very short one.
Dr. Abel, can you share your screen?
Yes. 1 second. Let me share 1 second. Many times people get varicose vein, they get swollen, they get broken up, and it's just a very painful situation for most people, and the swelling and so on. But do you see this lady? Okay, you can see there, right?
Yes, we can see.
Okay. This was in Paraguay, by the way.
We are here with Eva, who came 2 weeks ago for the first time. You have very swollen legs due to varicose vein and also a lot of back pain. How are you feeling today, Eva? I am very well. The swelling has gone down completely and the varicose veins are disappearing. Your leg has gone down to half of what it was. It's very different from how it was before. And you were also in a lot of pain. You couldn't sleep. And besides, when I want to massage my leg, I couldn't because it hurts and was very tight. And now it has improved a lot? Yes, completely. Due to the use of ghee with ash, right? Yes. In addition, you apply warm compresses with ash to the leg and also take the ash. It is truly amazing that this has improved so much in only 2 weeks. And my blood pressure is also normalizing. This morning I woke up with the blood pressure of only 116. That's good. Really excellent.
So, as you could see, varicose veins, that was twice more or less the size of what she had. She still, you can see they're still swollen there, but they were much more swollen. Just to the touch, it was a lot of pain. She couldn't have massaged anything. And as you said, you heard at the end, she said she was suffering with high blood pressure. Anyway, she started taking the ash, doing the fire, those 2 weeks, and the blood pressure normalized. Okay. So, by the way, also she mentioned that she applied the agnihotra ash with ghee, create a little paste, and locally in the area where there's swelling, you can apply that. So, in this is around the legs because of the varicose veins, So that helped her. So this is another experience that you can see. With agnihotra ash, you can do so many things. There is many different type of prescriptions that can be developed with the agnihotra ash. Dr. Monica Koch, from a pharmacist from Germany, she have written some prescriptions with agnihotra ash, how to prepare it depending on what kind of problem is. There is a little book called Ancient Healing with Homa Therapy, or with the ancient science of Homa Therapy. And you can get it. I believe you can get it even on YouTube for free and in her website. I will let you know, I-Inspire group, I will let you know the link and so on later. I don't have it on hand, but that will be good. So anybody can look into the little book and get some ideas how to use like agnihotra ash for other problems. Okay. So this was a varicose veins, and can share another video. Let's share another more before time flies out. Okay, and we have more questions. Aha. Okay, this is Mrs. Maxima Lago. She have thrombosis in the leg, and we'll see what happened with her.
Can you tell me your name, please?
Maxima Largo Vasquez,
And your age is?
58 years old, and I live in southern Guayaquil.
Southern Guayaquil in Ecuador, right?
Yes,
Very well. Can you tell me what type of sickness you had before the practice of Homa Therapy?
I had a thrombosis 2 years ago, not 2 years exactly. I couldn't move the left side of my body. I couldn't walk. I had to drag my feet and hands. I couldn't even hold this cart. I was in the chair. When I found about Dr. Montofer, I began doing the Homa Therapy, and it's been a year since I don't have to use the cane. I still have some heaviness in my mouth, but I can speak and work. And for me, the most important thing is this ash that is miraculous. For me, it is miraculous because one day I say, my God, what do I do? I can work. What do I do? The clientele had gone, so I put a little sugar with a little ash in the bucket, and over it made the sign of the cross, saying, "Oh, Shiri." And I started my business. Since then, I have customers every day. I thank God because I have faith in this. I take this ash as many times as I need during the day.
Agnihotra ash, right?
Agnihotra, of course,
Do you make the fires every day?
every day at 6 in the morning and 6 in the evening, no matter where I am, because I carry my pyramid with me all the time. I leave my house at 3 in the afternoon, and I take my pyramid with me. So when the times come, I make the fire wherever I am.
How long have you been doing Homa Therapy?
2 years,
How long were you sick before Homa Therapy?
3 years.
And now, can you stand up, please?
Yes, of course. I can stand, I can walk, I can even drive.
Very good. Perfect.
This is the side I couldn't move, and now I am very, very well, only by the grace of God.
Ultimately, it is by the grace of God.
That's how it is.
What's the name of your restaurant?
Odal,
Very good, Mother. Thank you very much, and God bless you.
Now let me mention something about her case. She had a thrombosis. She could not walk. There was the leg, and there was some paralysis and so on. Anyway, that opened up, thrombosis dissolved. She started walking, and she noticed also she had a restaurant, and there was not many people coming into the restaurant. She said when she started doing the fire, something happened. Something in the atmosphere, something in the environment happened, and more people started coming to the restaurant. And so she, according to her, the Homa helped not only her physically and emotionally and so on, but it helps the environment to make it somehow more palatable or some attractive to the people. They don't say anything. They go over there, but they feel at ease there. So the atmosphere does have an effect on the people's mind, just the atmosphere. So you already know epigenetics, how the environment have power over your well-being. And before everything was so-called genetics, the gene makes you overweight, the gene gave you cancer, the gene this and that. But gradually the idea that the environment, the field has an effect more than the gene is coming out strongly. And according to Ayurveda, the surrounding has a lot of influence in the health of plants, animals, and human beings. And this shows exactly to the point that even, you know, I tell people, you have a business where people have to come and do some shopping, whatever, of a store, whatever, do the fires. People will go there and sit, and they don't want to go. You don't, you know, they just, so there is a good opportunity. Just do it for the right reasons. Okay, let's share more because the time is flying. Let me see 1 second here.
Dr. Abel,
Yes, this is gonna be amazing. 1 second. 1 second. This is gonna be really good. We're gonna talk about now Commander Zurita. He's from the Navy. He's from the, this is a commander for the Navy. He was operating in the heart in Ecuador. Okay, he was the commander of the Navy base of Guayaquil. This is the main port of Ecuador, and he was the commander there. But he had a problem with the heart, so they operated, and still after the operation, he was having difficulties. So they told him to go to Chile, where supposedly they have better doctors and they will do another. They did another surgery there, and he is still having problems. Anyway, he belonged to the intelligence service and so on. And they want this, when they have this kind of people, they want them as healthy as possible. So the next thing, because he was still having problems, they sent him to the Bethesda Hospital. This is in the US. This is where they were attending presidents of the US. Okay, so he was taken there and operated. And he came out and still was having problems. His wife, Victoria, she learned Homa Therapy with us in Ecuador, in Guayaquil, Ecuador. And she asked if this could help her husband. So, well, you know, try it and see. So she went to the US, she took her pyramid, she started doing the fires, giving him the ash, and something happens. What happens? Let's hear it from source, from the same commander. Okay. Second. One second, please. Okay, now it will come up. Now it will come up. Okay.
Galapagos Islands. Now I am the naval commander at Galapagos Islands.
After that, he was the commander in the Guayaquil. Then something happened that he was so much better. He became an almirant, and then he became the commandant of the base in Galapagos Islands. Galapagos Island is one of the important places in the world. You already know.
I got a stroke 3.5 years ago. That's the end of 2001. And immediately I got an angioplasty in Chile. And 1 year later, I got a surgery, bypass surgery, at the Bethesda Hospital at Washington, D.C. 4 days after that surgery, I was at home, and my wife, who knew before the ceremony fires of the Homa Therapy, began doing those fires at home. and I began taking the Agnihotra ashes, as I do right now 3 times a day, and really it was wonderful because my heart is not sick anymore, and I feel very well, and I run, I make all my
activities.
All my physical activities very well, and I don't have any discomfort. After I came back to Ecuador 1 year later of my surgery, the Navy asked me for a test at the Naval Hospital in Guayaquil, and that test was so good. After I had done 1 year of Homa Therapy in the United States, that they didn't believe those tests, so they asked me to go to Quito for to the military hospital for making the same test again, and they were good again. They were good. They were more tight test, yeah. They were tighter test, more accurate test, and they said the same. I was good. My heart was fine. We have been now 7 months at Galapagos Islands, and we have very good experience teaching those that Homa therapy at the islands. I have here my wife Virginia, who can talk about those experiences we have had there.
My name is Vicky. I am Fernando's wife. We are practicing the fires like he told us in almost 3.5 years. And all my family is practicing the fires. My daughters and my granddaughter, who is 3 years old, she started almost 2 weeks ago to practice the fires. It's very nice to see the little girl making the fires. We teach Agnihotra fires in Galapagos Island. We teach in our house in the naval base from San Cristobal, Galapagos, and we have many people going and practicing Agnihotra at home. We have different kind of experience with them. Some people are getting very good, healthy on the fires, but I will talk only about a few. One of our friends, she was with some problem in her legs, called her, I don't know the name, gangrene, I think in English. And she started to make the fires and to drink and put in her legs these Agnihotra ashes, and now she is completely healthy. She doesn't have any more problem in her legs. And another person who came with heart problems because he didn't have money to the surgery. In a few days she was very good and able to walk without problems. And another person with problem with stroke, he couldn't move one part of his body, and now he's working again. And we practice the fires with all my family and with my.
As you can see, it's very difficult for them to talk about only one thing. It was for the husband. It was Fernando was amazing because, as you hear, he have surgery in Ecuador, then he have surgery. These are heart surgery. Then he have it in Chile, and then he have it in the U.S. Okay, and after 1 year of Homa therapy, they felt so much better. He in the military, after so many years of service, they have the possibility to be ascended. But for them, they had to be fit, not only academically, not only mentally, but also physically. And he told me that his superiors, they were certain that he was not going to come up because physically, you know, after 3 heart surgeries, you cannot do that much. Anyway, they did the test in Guayaquil, as you heard, and they were good. And they said, this is not true. This is not possible. He must be lying, or he gave some money to these doctors to put this test and fake it, because it's not possible. 3 operations in the heart in different places, it's not possible. So this is, they call him to Quito. Quito is the capital. Guayaquil is a sea level. Quito is about 2,800 meters. It's higher. So just the difference in altitude will mean that if he will have to have this test over there, there will be more difficulties for the heart. Anyway, they said, no, we don't believe the people around you, because you might, you know, you have to come to our hospital, military hospital, and do it with the doctors here. We want to make sure that it's true. So they come over there, they do the test, and he performed beautifully. He said, what is going on? This is not possible. He said, you have a heart like a, you know, a young man. You should not be like that. But he was so happy, and he was then he was sent to Galapagos. This is an Sunday. He was the authority there, and he invited us over there. And that's why they teach. You saw that my whole family, he said, does the fire. Even the little one, even the grandchild, 3 years old, she was doing the fire. So this is, and then she was telling other experiences of people who have gangrene in the leg. You know, when they sometimes they want to amputate a leg because they have the gangrene and so on, with especially when they have diabetes and so on, and they recover. Anyway, there is more to share. I want to share, Mrs. Hoy, how are we doing with the time? We have 5 more minutes to check another video, to share another video.
Yes, we can share another video. Then we open to Q&A to the floor.
Okay. Now let's share then. This you won't believe, and you don't have to believe, but this is very good. Let's see. Hypertension, stroke, leg swelling, Parkinson's.
Here we are at the Homa Therapy Center in Jaén, and we have some people with us who are going to share some experiences. Sir, can you please tell us your name and address?
Sure. My name is Manuel Esteban Bustamante. I live on Calle Villanueva, Pinillos, 1161.
How old are you?
I am 78 years old.
And for how long have you been doing Homa Therapy?
I've been doing it since you came last time. I don't remember the exact date. I began there in Sinamo and later in San Agustin at the Institute, at the Council, and then on the 3rd day here.
So, about 4 months ago?
Yes, more or less. From then on, I have continued with the Homa Therapy.
Very well. Now tell me, what health problems did you have before coming to Homa Therapy?
I used to have the following problems: high blood pressure, then I had a stroke, and I had been improving for a while.
You mean a stroke in the brain?
Yes, but then I got a little better. I was driving, walking, but later on my feet got swollen. I was swollen from the soles of my feet to my waist, and I couldn't even walk for 2 months.
So your legs were very swollen.
Yes, and then I got Parkinson's.
So you showed signs of Parkinson's disease.
Yes, and one of those days you could say that I got lucky because I had to sign a document in front of Dr. Tenorio Collante, and I couldn't sign it due to the tremors. And then the doctor asked me if I had Parkinson's disease. I said yes. Then he asked me since when. Some time ago, I told him. I had gotten better, but now I am getting sick again. Then he told me, if you want to heal yourself, I have a therapy, which is called Heal Yourself with Fire, or Homa Therapy. And if you want to heal yourself, try this. And he gave me the ash to ingest. I asked him then, why do we eat this? He answered, according to ancient science, people were cured with this, and then we changed it for other medicines and the help of new physicians. But since we are tired of many medications, we are returning to this therapy. Keep an eye out, he told me, because a doctor named Abel is coming here to bring the therapy. After a few days, I asked him, when is the doctor going to come? He told me that he was in Ecuador or Colombia, and he didn't know exactly where. A few days went by, and I asked him again. But then he told me, you came right on time because the doctor has come. He is here. So I found out where the therapy was, and it was in Sinamos. I couldn't walk from my house to Sinamos, which was about 3 or 4 blocks away, due to my swollen feet. But anyway, somehow I managed to go there, and I attended the Homa Therapy. I also went on the second day at the San Agustin Institute, and on the third day at the council, and then I got my period. On the fourth day, the therapy was done where we are right now, and since then I have kept coming here. Let me tell you that I was so swollen and I couldn't walk. I also had Parkinson's, but between the third and fourth Homa Therapy sessions, every single symptom was completely removed from me.
You can see Mr. Manuel there and his wife, each one with their own pyramid. Look at the pyramids. And this, after the 4th day, all the symptoms disappear. Look at this fire. What does it look like to you? Okay. Okay. We're open now.
That was an amazing testimony, Dr. Abel. Really amazing. I mean, comorbidity with so many different things, Parkinson, and and all the other neurological issues and all that, and then he just snaps out of it. All the symptoms disappeared. Amazing, amazing testimony.
Amazing, amazing, and everybody saw it. You know, this is like when it happens in front of you. You know, what can you say? Just
Dr. Abel, he said that he only did it for 4 months, right?
No. This happened after the 4th time. After the 4th day. After the 4th day. Okay? 1, 2, 3, 4 days. This is like, how is it possible?
Better than all the Parkinson medicine, right?
Stop the shaking, everything, the swelling gone, and all this kind of. How is it possible? That's why I left it for the end. We have many good testimonies. Then we have another one where he's talking about somebody who have a son with a problem with the heart. You know, between the ventricle, there was a perforation. It requires surgery and so on. Somehow it was fixed. I don't know if you could hear in Vicky's testimony. There was a lady, a gentleman who had a problem with the heart, but didn't have the money for the surgery. And he could not move, he could not walk, and they didn't have the money for the surgery, problem with the heart. They did a fire to the eyes, and they started walking, and somehow it got solved. This is like, this is like, it checks your mind. So all these people, especially the medical people, will say, please don't believe anything. Do whatever you're doing. If you're happy doing whatever you're doing, keep doing whatever you're doing. But if you want to try something different, you can try this. But do not be surprised that you will feel like you want to cut off your head and put it in blender and forget about everything else because something happened, something you cannot explain. And this is the thing. If you're willing to face something like this, fine. If you're not, then continue on your own route, because this will transform. It transforms your perspective about what life is all about, what is energy, what is health, what is so on and so on and so on. And as you see individually, this is, anybody can do it. You don't have to be Catholic, Christian, Buddhist, Hindu. You can be atheist. You can be whatever you want. You can be a drunk. You can be a stealer. You can be a robber. You can be a liar. You can do anything. However, if you do this, you will see that something happen in your mind, in your heart, and you start being changing yourself, not because of somebody else, but something is happening within you. You don't want to lie. You want to be more careful about what you say and what you eat and so on. And that happens as a transformation. People call it transmutation, alchemy, whatever you want to call it, you're free to do that. But the fire, this fire had the power to transform the mind and the heart and the body, as you can see also. But we are not the body, we're not the mind, we're not the emotions, we are something higher than that. And whether you like it or not, you can investigate, research if you want to. If you don't want to, it's okay, do whatever you want, but this will help no matter what. It helps plants and it helps animals. The animals and plants don't believe in anything. So now we're open. We have more to share, but maybe we don't have the time. So we're open to, this is Dr. Soo and all the questions that you might have.
So now we open the floor to question and answer. So anybody, please feel free to ask your question. Anybody want to ask question to Dr. Abel?
Yes, yes, yes. Okay, we're open for the questions.
Well, if nobody is going to ask a question, then I will ask a question. The one with the varicose veins, so they use the Agni ash, they mix it with the ghee, and they rub it on the veins, on the varicose veins, or what was the procedure?
Yes. They prepare the Agnihotra ash. They're very powderized, very like a soft, very like, and then it is better if it is filtered through a very fine sieve, and then it's joined, combined with some ghee, and make a little paste like an ointment, and then you can cover this area with this Agnihotra paste, and that will help to relieve the swelling and reduce the damage of the tissue. Okay, and the same thing goes with the gangrene, the pains. When there is a wound, and if it is open, you can just put the powder or the Agnihotra. You don't use the ghee because it's already wet. But if it is a wound that is kind of like a dry, but it's still a wound there, you can apply it with ash and ghee. You make the cream, the paste, and put it there. People who have arthritis, this is another topic. I don't want to jump into something else. But
yeah,
anyway.
we don't want to. We stick to the cardiac today. I think there's another question. Is there Su Xiao Yan asked this question? Is there any difference the morning and evening session?
When you do it in the morning, it energizes you for the whole day, and when you do it in the evening, it prepares you to have a restful sleep. Otherwise, the healing ash is the same. Okay.
We have another question from Sharon. She asked, when we do Agnihotra, it attracts spirits who are looking for peace and light to come over. What if we stop practicing for a period of time? Will the spirit stays with us, waiting for the fire? I don't know how this is related to cardiac, but that is an interesting one. Dr. Abel, would you want to take that?
Well, remember, we expose this therapy to every single people without any expectations, whether they believe in spirits or not. People do these practices and good things happen. Yes, yes. For many, this is an angelic process. So angels come into the picture when this is done. But and from our perspective, whatever you do, if it's giving you results and it's attracting all this, keep on doing it. If it is not, if you stop doing it, chances are you will not have the result. We have now people who have gotten the therapy and it helped them a lot, and they stop and it continue for a while, and then it goes back to the regular whatever problem they had before because they stopped. So we are in a world now. There is so much stress, so many difficulties, so much corruption, so much pollution that ideally common sense will tell you, get your aura field, your protective energy field all the time on. You will not dare, you will not try to navigate an internet without a firewall, without an antivirus, because you know in a short time it'll break down. Because there's going to be attacked from many sorts. Likewise, we have to navigate, we have to move in so many different areas, and there are many other factors, multifactorial factors that can be detrimental to our physical, emotional, mental health. So why not just take
Dr.
something?
Abel, we have quite a few questions that you need to answer. Someone asked, I used to have very low blood pressure. Can Agni boost my blood pressure up?
Homa therapies bring you into balance. Well, if it is down, it brings it to the normal. If it is up, it brings it to the normal. It brings to make the balance, and the balance is health. Okay, so yes, if you have problem with low blood pressure, it will raise it up to the normal.
Another question is, should we consume Agnihotra ashes mixed with water daily if we are healthy?
Particularly, I think that everyone should have it because most people, everybody is a little sick. One are sick in the others, but we're all a little bit sick because we are in a contaminated world. The whole thing is around that, you know, that if you want to breathe pure air, you may have to travel in 1,000 years back, or maybe 500 years back when there was no pollution in the air. Now we don't escape. So no matter how healthy you think you are, we have some pollutants. And with Homa therapy, we can counteract the pollutant in whichever situation it is. So
Dr. Abel, I'd like to add a little bit to what you just said over there. When we consume Agnihotra ash, what happens is that it helps. It's like a prebiotic, probiotic, everything put together, you know, in one in the ashes. So when we consume it, for it kind of like help our gut bacteria. It improves the ecological system of our gut. Once that is improved, then of course it helps our heart, because our heart don't have to work so as hard as as it usually does. So yeah, consuming Agnihotra ash certainly can help with those who are healthy as well, because it heals your heart by healing your gut and the rest of your body. It removes the toxin from every cells that is within your body. I mean, Dr. Abel, do you agree with that?
Definitely, yes, it does. Definitely, we have people who have problems. You mentioned the gut, so some have people have celiac or some crowns problems, the intestinal absorption. Yes, yes, it will help the digestion. It will help, and at the same time, it will help the heart. There is a connection. You see, only us, only this small mind think that you can be healthy. Focalize in one area. Health is a total, is a holistic approach. It should be, but we separate like circulatory, respiratory, and immunology, and so on. But like you saw with Manuel Bustamante, he have a problem with the heart, and then he have a stroke, then he have this Parkinson. But besides that, he have some swelling on the legs and all this. So one thing goes to the other. Everything is connected. That is, if we could have some type of approach which is more holistic, to treat body and mind and all the body systems, wouldn't it be great? And besides that, even if we could try only the whole body, but we do not treat all our environment, our surrounding, we'll still be sick, because you cannot have a healthy fish swimming in a sick environment, can't you?
Yeah,
You
that's
can.
true. Yeah.
So it is almost, it is a must. You have to think about in a holistic way, but for the sake of simplicity, we are going system by system for your own sake. But normally it is, you know, it's like a Dr. This is Master Vasan one time was talking about a story. It's a joke. It's not true. Somebody go to a doctor. He has a problem, a very difficult problem in the eye, and then the patient says, you know, I was told you are the best ophthalmologist. You are the best doctor. You can fix me and all this and all that. And look, please look into that. He looked very carefully, and then he said, unfortunately, there is nothing I can do for you. I said, why? You are the best. He said, why? I'm the best, but I'm specialized on the right eye, and you have it in the left eye. So this kind of, I cannot do it. But you see, there is no such a thing, a right doctor, a doctor for the right eye and doctor for the left eye. But we can become so narrow, so pointing one thing that we forget that there is a connection between everything. Remember that what I said was a joke. It was not true. There was a joke. But we are like in general terms. You know, I tried only the heart, or I tried only the liver, or I treat only the intestines, or something like that. Yeah, you can treat all this, but there is a connection with everything. So eventually, we have to consider a holistic approach. Okay.
Thank you very much, Dr. Abel, for that wonderful, wonderful presentation and for all the answers.
I have more video to share if you want to, yeah, because I think we have 15 minutes, but questions or comments, questions are there also. I just don't.